Hello everyone. So we have a 8-year-old boy and he has been brought to you for bilateral leg and back pain. His pain started yesterday and has gradually worsened. There is no relief with ibuprofen, acetaminophen and warm packs, the usual analgesics. There is a history of sickle cell disease with the patient. He had 5 prior hospitalization for similar pain episode in his back and the legs. Hydroxyurea has been prescribed, but prescription has not been filled due to lack of insurance. Mild temperature, BP and normal pulse tachycardia is there. Respiration 20. Uncomfortable appearing boy with conjunctival pallor, pain, palpation of bilateral leg pains, they show tenderness. But there is no edema or swelling. As far as complete blood count, hemoglobin is reduced, hematocrit is reduced, MCV is in the normal range, reticulocyte is definitely increased, platelet count is in the normal range, leukocyte are increased slightly. Most likely finding that can be seen in this patient is answer is Howell-Jolly body, HJB in short the writers. Well, you can see the peripheral blood film. This is typical Howell-Jolly body scene. What is this? I'll talk in the coming slides. The patient is a known case of sickle cell disease and he has vaso-occlusive pain crisis now also, and they have at least 4-5 episodes in the past also. Okay. And what happened? Repeated microinfarction occur due to clumping of sickle cell, and that can even destroy the splenic tissues. Rather, you can say they can lead to microinfarct of any organ of the body. Typically, spleen. The chronic damage and autoinfarction of spleen can lead to functional asplenia by the age of 5 years. So this child is of 8 years now. By the time of 5 years, there is a spleen are already destroyed, and it is asplenia. So we all know spleen plays a very important immunological role in clearing bacteria in the blood. Okay. Well, now I have a question. Stop the video, write down the answer. Functional asplenilia lead to susceptibility to which infection? Okay. Write down the answer. Particularly encapsulated bacteria. Staph pneumonia, H. influenzae, and Neisseria meningitis. They are the 3 common organisms which can cause infection in a patient of sickle cell anemia. Well, in addition to that, functional spleen removes normal nuclear remnant of the RBCs, also called Howell-Jolly body. So they are the nuclear remnants, and they are removed by the normal spleen. Now, definitely, patient having where spleen is removed, maybe by surgery or maybe functional asplenia, like in our case of sickle cell. Howell-Jolly body will be there because they are not getting removed. Spleen is not functioning, so they will remain. And they appear as a small purple dot within the RBC that we saw in this lovely picture also. Okay, lovely purple drop is there. Well, look into this again, one more lovely picture. Now let's talk about other option. Basophilic stippling represent the ribosomal precipitate. I'll show you the picture in the next slides. They appear as the blue granules of various size dispersed throughout the cytoplasm of the RBC. So they are dispersed. They are seen in thalassemia and lead poisoning. This is very, very important question. Look into this. Look into this. There are basophilic stippling. You can see total spreading of these small dot in the cell. What about other option, Byte cell and Heinz body? Heinz body, they appear as a small inclusion within the RBCs. They are aggregate of denatured hemoglobin. They are seen in G6PD deficiency and thalassemia. Although Howell-Jolly body are seen in thalassemia, but classically sickle cell. Similarly, Heinz body is more commonly asked in the exam for G6PD deficiency. Well, we also see phagocytes extract the large rigid precipitate. They form classically Byte cell. Look into this Byte cell. We are getting like this thing. Okay. Heinz body. Okay. Now, helmet cells or schistocyte, they are fragmented RBCs. They present suggest traumatic microangiopathic hemolytic anemia. What we write as MAHA. Okay, and this we see in DIC, disseminated intravascular coagulation, hemolytic uremic syndrome, thrombotic thrombocytopenic purpura. Helmet cells are not seen in sickle cell disease, as this hemolysis is intrinsic, not traumatic. So they are not seen. Look into this lovely schistocytes. Golden line to remember, Howell-Jolly body are nuclear remnant and that are usually removed by functional spleen. But in functional asplenemia, in sickle cell, Howell-Jolly body are expected finding in the peripheral blood film. They are seen as a purple dot. Thank you very much.